So tell me a little bit about, like, what is BFR training?
Yeah, so BFR training, it stands for blood flow restriction training. And essentially what you're doing is you're using a cuff.
Oh, okay.
It can be a pneumatic cuff, or it can even be like a band
Okay.
at the top, typically the top of your limbs to restrict blood flow back to the heart.
Oh, okay. So like a tourniquet, kinda?
Kind of like a tourniquet, but not as tight. You're not trying to completely stop blood flow.
Gotcha.
You just want to restrict it a little bit.
And that, like, does what, like, why would I want to do that?
Yeah, so when you restrict blood flow to the muscles, you actually create this hypoxic environment.
Hypoxic environment.
Yeah, which means low oxygen.
Okay.
So when your muscles are in this low oxygen environment, they have to adapt and they have to work harder,
Okay.
even though you're using lighter weights.
So it's like tricking my muscles into thinking they're working harder than they actually are.
Exactly. And that's what makes BFR training so effective,
Okay.
because you can get the same results as if you were lifting heavy weights, but with a much lower risk of injury.
Okay. That makes sense. So, like, where did this even come from? Like, how did we figure this out?
Yeah, so it's actually been around for a while. It was developed in Japan in the 1960s
Wow.
by a doctor named Yoshiaki Sato,
Yeah.
and he called it kaiatsu training.
Kaijushu training.
But it's basically the same thing as BFR training.
Gotcha.
And over the years, it's gained popularity all over the world, and it's used by athletes,
Okay.
rehab patients, and even just regular fitness enthusiasts.
So it's not just like a niche thing anymore. It's like pretty mainstream.
It's becoming much more mainstream now. Yeah.
So, like, how does this actually work? Like, what's going on in the muscles when you restrict the blood flow like that?
Yeah. So when you restrict blood flow, it creates that hypoxic environment I was talking about,
All right.
and that triggers a bunch of physiological responses.
Okay.
So one of the things that happens is you get a buildup of metabolites in the muscles.
Metabolites.
Yeah, like lactic acid.
Okay.
And that buildup of metabolites actually signals to the body that it needs to grow more muscle.
Oh, okay. So it's like tricking my body into thinking I've done more damage than I actually have.
Exactly.
Interesting.
Another thing that happens is you get increased recruitment of fast twitch muscle fibers.
Fast twitch muscle fibers.
Yeah. So those are the muscle fibers that are responsible for power and strength.
Okay.
And they typically only get activated when you're lifting heavy weights.
Gotcha.
But with BFR training, you can activate those fast twitch fibers even when you're using lighter weights. And then the third thing that happens is you get a surge in growth hormone production.
Oh, wow. So this is like actually boosting my hormones.
Yeah, exactly.
Interesting.
And growth hormone is a really important hormone for muscle growth.
Okay.
So the combination of all these factors leads to significant muscle growth even when you're lifting really light weights.
Okay. So it's like a triple whammy. Like you've got the metabolites, you've got the fast twitch fibers, and you've got the growth hormone all working together.
Exactly.
Wow. That's pretty impressive.
Yeah, and it's a really safe way to train as well.
Okay, talk to me about the safety aspect of this because
Yes.
I feel like a lot of people are going to be like, wait, you're putting tourniquets on yourself?
Yeah.
Isn't that dangerous?
Yeah, that's a common concern, but when it's done correctly, BFR training is actually very safe.
Okay.
So it's important to start with a low pressure and gradually increase it as you get more comfortable.
Okay.
And you never want it to be painful. It should just be a tight sensation.
Okay, so it's like a 7 out of 10, discomfort level.
Okay. And you also want to make sure you're using the right equipment.
Oh, okay.
So there are different types of cuffs available, and you want to make sure you're using one that's appropriate for your size and your fitness level.
Okay, so like you wouldn't just grab like a rubber band and tie it around your arm?
No, definitely not.
Okay,
You want to use a cuff that's specifically designed for BFR training.
gotcha.
And it's also important to listen to your body and stop if you feel any pain or discomfort.
Okay, so like any kind of numbness or tingling would be a bad sign.
Exactly, yeah.
Okay, so like what are some of the benefits of BFR training, like besides just muscle growth?
Yeah, so there are a lot of benefits to BFR training.
Okay.
So in addition to muscle growth, it can also improve muscle endurance,
Okay.
increase cardiovascular capacity,
Wow.
speed up recovery from injuries.
That's huge.
Yeah, and even enhance bone tendon and ligament health.
Wow, that's a lot of benefits.
Yeah, it's a really versatile training method.
Okay, so like who is this good for? Like is this something that like everyone can do or is this like more for athletes or people with injuries?
Yeah, so BFR training can be beneficial for a wide range of people.
Okay.
So it's definitely a good option for athletes who are looking to improve their performance,
Okay.
but it's also a great option for people who are recovering from injuries
Okay.
or people who are just starting out with exercise and maybe can't lift heavy weights yet.
Gotcha. So like if I'm just getting back into working out after like a long time off,
Yeah,
this would be a good way to kind of ease back into it.
exactly.
Okay.
And it's also a good option for older adults who might be at a higher risk of injury from lifting heavy weights.
Right, because you're not putting as much stress on your joints.
Exactly.
Okay, that's really cool.
Yeah.
So, like, how often should I be doing BFR training? Like, is this something that I can do every day, or is it more like a couple times a week kind of thing?
Yeah, so the frequency of BFR training really depends on your individual goals and your fitness level. But in general, it's a good idea to start with 2 to 3 sessions per week,
Yeah.
and you can gradually increase the frequency as you get more comfortable.
Gotcha. So, starts to listen to your body.
Exactly.
Okay, cool. And like, what kind of exercises can I do with BFR training?
So you can pretty much do any exercise with BFR training.
Okay.
So you can do weightlifting exercises,
Okay.
you can do body weight exercises,
Okay.
you can even do cardio exercises.
Wow. So I could like go for a run with like BFR cuffs on.
Yeah, exactly.
And you don't have to restrict blood flow for the entire workout. You can just
Yeah.
do it for certain sets or certain exercises.
Gotcha. Okay, cool. Um, so I'm pretty sold on this. I think this is something that I might want to try.
Yeah.
But I'm still a little bit nervous about the safety aspect of it.
Yeah.
So what would you say to someone who's like on the fence about trying BFR training?
Yeah, I would say that the most important thing is to do your research and make sure you're working with a qualified professional.
So there are a lot of resources available online, and there are also a lot of certified BFR trainers who can help you get started safely.
Gotcha.
And I would also say that it's important to listen to your body and not push yourself too hard.
Okay.
So if you're feeling any pain or discomfort, stop and adjust the pressure or the exercise.
Right.
And just remember that BFR training is a tool.
Okay.
And like any tool, it can be used safely and effectively, or it can be misused.
Right. Okay. So it's not like a magic bullet.
Yeah,
It's something that you have to be smart about.
exactly.
Okay, cool. Well, I think this has been super helpful.
Yeah.
I've learned a lot about BFR training, and I'm definitely intrigued.
Awesome.
I might have to give it a try myself.
Yeah, I would definitely recommend it.
Cool. Well, thanks for coming on the show and sharing your expertise with us.
Yeah, no problem. Thanks for having me.
And for everyone listening out there, if you're interested in learning more about BFR training, be sure to do your research, find a qualified professional, and always listen to your body. Stay tuned for our next deep dive, where we'll be exploring another cutting-edge fitness technique. Until then, keep diving deep.
Sounds good.